Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This week we cover major developments and events from October 30th through November 6, 2025, across the Middle East's healthcare, public health, life sciences, and wellness landscape. These areas are vital not only for the region's populations, but also for governments, hospitals, research institutions, pharma and biotech firms, and wellness organizations. In this report we'll walk through key sections, from policy and research to hospitals and population health, bringing you detailed, country-specific updates and analysis. Our sources include official health ministry releases, news agencies, WHO, UN updates, and NGO reports, all carefully cited below. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. This week, HealthConnect Middle East surveys a region striving for a healthier future through ambitious government initiatives, cutting-edge research, industry partnerships, and community wellness campaigns. From Abu Dhabi's year-round global health platform to humanitarian relief in conflict zones, the past week showcased both bold progress and persistent challenges. Leaders are investing in resilient systems and innovative science even as public health crises demand urgent action. Governments are planning for the long term while tending to immediate needs, researchers are pushing boundaries in genomics and AI, and communities are rallying around wellness and prevention. It's a story of hope, determination, and hard lessons, all unfolding across the Middle East's diverse health landscape. First, we have healthcare policy and government initiatives. Governments in the Middle East pressed forward with reforms, strategic plans, and international partnerships to strengthen health systems over the past week. A standout development came from the UAE. Abu Dhabi's Department of Health launched Future Health, a global initiative by Abu Dhabi, transforming its annual Global Health Week into a continuous year-round platform for international health collaboration. Under the patronage of Sheikh Khalid bin Mohammed Al Nahyan, this initiative shifts from a one-off conference to a continuous, connected ecosystem of ideas, investment, and action in healthcare. Future Health will foster ongoing co-creation of solutions, joint research programs targeting critical needs, and regular global dialogues, all aimed at uniting leaders across policy, technology, and philanthropy to design a healthier future for all. Anchored in Abu Dhabi's strengths in innovation and AI, it focuses on four themes: longevity and precision health, health system resilience, digital health and AI, and life sciences investment. The first Future Health Summit is slated for April 2026 in Abu Dhabi, but importantly, a slate of initiatives kicks off now: pilot programs to test and scale solutions, foresight research to identify emerging challenges, and impact reports to track progress. By launching Future Health, Abu Dhabi is asserting itself as a global convener in healthcare, moving beyond episodic events to a sustained leadership role. As Chairman Mansour Al-Mansouri put it, the platform transforms commitment into action by connecting the brightest minds and strongest partners to deliver real health impact worldwide. In short, this signals a new model of diplomacy through healthcare, positioning the UAE as a catalyst for global health innovation and cooperation on issues from pandemic preparedness to healthy aging. Regionally, GCC countries took concrete steps to deepen their health cooperation. Health ministers and officials from the 6 Gulf states met in Kuwait in what was reported as the 11th GCC Health Ministers Committee meeting, and the 88th meeting of the Gulf Health Council. At this gathering, hosted by Kuwait's Health Minister Dr. Ahmed Al-Awadhi, the ministers approved a series of joint initiatives and a new 4-year GCC health strategy for 2026 to 2030. The plan, described as a roadmap for a new stage of collective health action, puts strong emphasis on prevention, health promotion, and readiness to face risks. Among its pillars are the expansion of unified procurement and drug registration programs, building on existing Gulf efforts to collectively negotiate medicine and vaccine supplies for cost savings and security. The ministers also endorsed the GCC WAFE program, which coordinates health screenings for expatriate workers entering member states to control infectious and chronic diseases at the border. Additionally, they adopted a GCC strategy to combat drugs, 2025 to 2026, as a joint response to cross-border substance abuse challenges. Digital transformation was another key theme. Al-Wadhi, chairing the meeting, highlighted that innovation and digital health are two main pillars in developing Gulf health systems going forward. In practical terms, the ministers agreed to strengthen the GCC Joint Committee for Healthy Cities, aligning it with each country's national vision, and announced a new GCC Health Excellence Award to encourage quality improvements and innovation in healthcare services. These outcomes reflect a growing recognition that many health challenges, from controlling outbreaks to improving healthcare quality, are better addressed collectively. Saudi Health Minister Fayed Al-Jalajel, attending the Kuwait meetings, noted that the discussion centered on advancing integration, developing Gulf health cities, standardizing medical training, and leveraging technology like AI to improve care. He stressed the GCC leaders' commitment to boosting the region's health presence and supporting global partnerships, positioning the GCC as a bloc that can speak with one voice on international health issues. The clear message is that the GCC is moving forward confidently in health cooperation, as Al-Wadhi said, with a shared vision that transcends national boundaries. Meanwhile, individual countries rolled out notable policy moves. In Saudi Arabia, health sector transformation under Vision 2030 remained full steam. The Global Health Exhibition, GHE, 2025 in Riyadh, October 27 to 30, provided a stage for Saudi Arabia to signal upcoming deals in biotech and healthcare investment. The Health Ministry hinted that several strategic partnerships in vaccine production, pharmaceutical manufacturing, and digital health would be unveiled around the event. While details are pending, this aligns with Saudi's ambitious target to double private sector contribution to healthcare to SAR 145 billion, and grow the overall health industry to SAR 318 billion by 2030. Saudi officials at the Forbes Healthcare Circle, a side event of GHE, further emphasized innovation and sustainability. They honored leaders like Dr. Nasser Al-Hakbani, CEO of Health Holding Company, who was recognized for implementing the Saudi model of care across 20 health clusters and expanding preventive services. Across the Gulf, Oman also advanced its health policy agenda with a focus on NCDs. On October 1, Oman's Ministry of Health held a session on a new national policy for prevention and control of non-communicable diseases, as reported by the Oman News Agency. This policy framework is designed to tackle the Sultanate's rising burden of lifestyle diseases like diabetes, heart disease, and cancer, which are now responsible for over 72% of Omani deaths, according to WHO figures. Omani health leaders, including the MO's director of NCDs, Shafar al-Razi, stressed during a high-level UN event on October 21 that multi-sectoral action is key. Oman intends to mobilize all health-related energies, from urban planning to school programs, to enable healthier lifestyles and address risk factors early. The national NCD policy will set targets for reducing smoking, improving diets, and boosting physical activity, while strengthening primary care to manage chronic illnesses. This week's activities followed up on Oman's earlier achievements. Oman had recently integrated NCD surveillance into its primary care clinics, and even hosted a global gathering, the World Cancer Congress in Muscat, late October, to share best practices. By institutionalizing an NCD policy, Oman is aligning with regional efforts, the GCC NCD plan and the WHO 25 by 25 goals, and ensuring that non-communicable diseases get sustained attention alongside infectious disease threats. In Egypt, the government underscored that health sector reform remains at the forefront of its domestic agenda. Prime Minister Mustafa Madbuli used a cabinet meeting in early October to reiterate that healthcare, along with education and the Rural, Decent Life program, is a top national priority. Practically, this has translated into multi-ministerial coordination to overcome bureaucratic hurdles in health projects. Late September saw Health Minister Dr. Khalid Abdel Ghaffar meet with officials from other ministries, including military production and administrative development, to accelerate the construction of new hospitals and medical facilities. As a result, several large hospitals, medical warehouses, and family health centers are now being fast-tracked in Egypt's new administrative capital and other regions, with completion timelines set for 2025. By tapping the Ministry of Military Production's logistical expertise, Egypt aims to ensure these critical infrastructure projects don't stall. This whole-of-government push highlights Egypt's determination to modernize its healthcare delivery and expand capacity, in line with President Abdel Fattah el-Sisi's Vision 2030. Public demand for better services has grown amid Egypt's population boom, and the government's response, poor resources into hospitals, workforce expansion, and quality initiatives, has been further galvanized by the COVID-19 experience. As Minister Al-Ghaf noted, effective health governance is now seen as integral to Egypt's social stability and economic development. One tangible outcome, the Health Ministry announced this week that from August 1 to October 20, over 902,000 state-funded treatment decisions were issued under Egypt's universal health insurance and financial assistance programs, at a cost of EGP 8.1 billion. This allowed more than 806,000 Egyptian patients, especially low-income and uninsured, to receive free or subsidized specialty care and surgeries. The ministry even utilized telemedicine. It reviewed 2,045 medical cases via video conference, approving treatments remotely so patients in provinces didn't have to travel to Cairo for committee approvals. These figures, released on November 6, demonstrate the government's commitment to expanding healthcare access despite budget pressures. They also serve a political purpose, reassuring the public that reforms, like the new health insurance system, are yielding benefits. In summary, Egypt is attempting to deliver quick wins, more hospitals, millions of screenings, funded treatments, while laying the groundwork for sustainable improvement, a balancing act between immediate accountability and long-term system change. Finally, the intersection of health and foreign policy was on display as Middle East governments engaged in health diplomacy. The Saudi-Syrian health cooperation is a prime example. On the sidelines of diplomatic normalization, Saudi Health Minister Al-Jalajel and Syrian Health Minister Dr. Musab al-Ali met in Riyadh to sign an MoU that concretizes support for Syria's beleaguered health sector. Under this agreement, Saudi Arabia is directly linking Syria into its vast telehealth network, the Seha Virtual Hospital, and providing expertise in emergency care, e-health systems, and preventive programs. The partnership also includes training exchanges, expert visits, and joint workshops, effectively integrating Syrian healthcare professionals into regional knowledge networks. Since Syria's return to the Arab League, the Gulf states, led by Saudi, have increased humanitarian aid to Syria. Shipments of dialysis machines, vaccines, and power generators have been noted over recent months. This week, WHO's Syria representative in Damascus highlighted the importance of such support in a press briefing. Since mid-year, as Syria transitions from emergency to recovery, hundreds of health facilities have seen funding gaps as global aid wanes. Bridging this transition gap is crucial to prevent the collapse of services. Saudi's King Salman Relief Center, Case Relief, stepped up again with a new $4.5 million donation to WHO for Syria's health needs, announced in late September. Additionally, Japan's support for Syria bore fruit. On October 5, Minister Al-Ali toured the newly rehabilitated kidney building at Homs Grand Hospital, a project completed with Japanese funding and UNOPS assistance. This rehab restores dialysis and renal care capacity in Homs, offering relief to hundreds of patients. Together, these examples show Middle Eastern governments engaging multilaterally to address crises, whether it's wealthy Gulf states funding relief in Yemen, Syria, and Gaza, or countries like Egypt coordinating border health measures with Sudan and Libya. Health has become a platform for diplomacy, enabling dialogue and cooperation even between states with recent political rifts. As conflicts and humanitarian emergencies persist in the region, such government initiatives and cross-border health partnerships are not only alleviating immediate suffering but also building trust and interdependence that could spill over into the political realm. It underscores a hopeful idea that collaboration in medicine and public health might pave the way for broader reconciliation and stability in the Middle East. Life sciences and research innovation is next. The Middle East's life sciences sector demonstrated inspiring progress during the week, with regional researchers and institutions pushing the boundaries of medical innovation. A groundbreaking achievement came out of Iran, where scientists announced development of the world's first AI-designed, personalized mRNA cancer vaccine. Researchers at Tehran University of Medical Sciences unveiled a smart mRNA vaccine for lung cancer that uses artificial intelligence algorithms to tailor the vaccine to an individual patient's tumor genetics. This personalized approach can drastically cut development time. The Iranian team reports designing and producing each patient-specific vaccine in just 2 to 3 weeks, roughly a 90% reduction compared to traditional methods that take years. Elsewhere, Saudi Arabia continued to bolster its reputation as a regional hub for medical research and health innovation. Although much of Saudi's big news in early November revolved around upcoming partnerships, see Biotech section, and accolades, see Wellness section, the kingdom's past investments in research bore fruit recently. For instance, a study by King Faisal Specialist Hospital and Research Center on robotic liver transplantation was recognized as one of the 10 most influential research papers of 2024 by the American Society of Transplantation. While this recognition came in late summer, it underlines Saudi Arabia's growing contribution to high-end clinical research, particularly in areas like organ transplant techniques, genomics, and regenerative medicine. Saudi research centers are increasingly producing work that gains international notice, aligning with the country's Vision 2030 goals to become a knowledge economy. Additionally, the Saudi Ministry of Health highlighted that 16 Saudi cities have now earned WHO Healthy City designations, including Jeddah and Medina, the first Middle Eastern cities over 2 million people to be accredited. This achievement, while rooted in public health, was backed by rigorous data collection and multidisciplinary research into urban health metrics, spanning pollution levels, walkability, community programs, etc., indicating a synergy between research and policy. The Healthy City Awards signal how Saudi Arabia is applying evidence-based approaches to make cities more health-promoting and often under-researched area in the region. Qatar also reinforced its role as a research and innovation leader in the region. Fresh off hosting a global mental health summit in late October, Qatar is building on its strong biomedical research infrastructure, such as Sidra Medicine and the Qatar Genome Program, to advance precision medicine. While no specific new study was reported this week, it's worth noting that Qatar recently launched an ambitious newborn genomic screening initiative, Begin NGS, in partnership with a U.S. institute, aiming to sequence infants for hundreds of treatable genetic disorders. That program, announced in late August, is presumably moving into implementation this fall. It exemplifies how Gulf countries are translating research into preventive healthcare services. By sequencing the DNA of newborns, Qatari researchers and clinicians hope to detect conditions early and develop personalized care plans, putting Qatar at the cutting edge of preventive genomics. Meanwhile, Qatar's scientific community was gearing up for the country's first disease modeling and therapeutics conference, which took place at the end of August, a gathering that likely spurred new collaborations and follow-on studies in drug discovery and computer-aided biology. The momentum from such events tends to carry forward. We can expect to hear about new research partnerships or grant programs in Qatar in the coming weeks, as outcomes of those conferences materialize. In short, Qatar is steadily becoming a regional nexus for life science research, focusing on areas like genetic medicine, neuroscience, and translational research that align with its national health strategy. In North Africa, Egypt pursued its strategic vision of becoming a regional pharmaceutical research and production hub. Although the headline moves, like forming a high-level committee to boost pharma R&D and exports, occurred in earlier weeks, the effects are ongoing. Egypt's Ministry of Health has been integrating scientific expertise with industrial strategy, for example by planning a dedicated authority to promote drug exports and by setting a target of $5 billion in medical exports by 2030. During our week in review, Egyptian officials continue to emphasize innovation in generics and vaccines as a means to both improve public health and drive economic growth. It's notable that Egypt's Prime Minister explicitly tied health sector improvements to broader government priorities this week, an acknowledgement that initiatives like the 100 million Healthy Lives screenings and the Women's Health Initiative rely on strong research and data analysis components to be effective. In fact, one milestone reported on October 7 was that Egypt's presidential initiative for supporting women's health has so far screened 70 million women for cancers and NCD risk factors. The Ministry of Health spokesperson noted that this massive dataset, covering women's cancer screenings, diabetes, blood pressure, BMI, etc., is feeding into improved treatment protocols and even turning some centers into research references for oncology. Essentially, Egypt is converting its public health campaigns into population research opportunities. The tens of millions of data points gathered are being analyzed to understand disease patterns and outcomes, fueling local research on women's health and informing evidence-based guidelines. This approach of learn as you screen ensures that large-scale interventions also bolster scientific knowledge and local evidence. Meanwhile, Iraq undertook an interesting fusion of research and healthcare planning. On one hand, Iraqi health authorities have been partnering with international organizations to improve data systems, for instance, completing a national student health survey in late summer to gather evidence on adolescent health behaviors. On the other hand, Iraq is launching large-scale projects, discussed in Hospitals section, that have research components, such as an integrated medical city which could become a hub for clinical trials and medical education. This week, an Iraqi delegation was also present at the OIC Health Ministers Conference where CESRIC, the statistical arm of OIC, launched the OIC Health Report 2025, providing comparative research on health indicators across Muslim countries. Being armed with such research allows countries like Iraq to benchmark their progress and prioritize investment, for example, in maternal mortality reduction or vaccination coverage relative to regional peers. It's a reminder that data and research collaborations are becoming part and parcel of health planning in the region. Collaborative research efforts also made news. The WHO Eastern Mediterranean Regional Office, EMRO, held a simulation exercise in late September on cross-border disease surveillance, involving Egypt, Libya, Sudan, Tunisia, which recommended establishing digital platforms for real-time health data sharing. This kind of initiative blurs the line between research and practice. It involves studying existing gaps and simulating scenarios, research, then proposing technological solutions, innovation, to improve early warning of outbreaks among migrant and mobile populations. Such recommendations, although just proposals now, may lead to the development of new data systems or pilot studies in the coming months. It also highlights an important trend, recognizing that disease threats and health issues don't stop at borders. Middle East researchers and policymakers are increasingly focusing on regional approaches and data harmonization. For instance, this week Egypt's Ministry of Health was reportedly drafting an agreement with Sudan on mutual recognition of vaccination records for people crossing the border, an immediate follow-up to that WHO simulation. Jordan, too, was noted as joining discussions, though not part of that specific simulation, on how to ensure continuity of care for migrants. In effect, the Population Health Unit, in some research is being reimagined as a transnational concept, treating a whole region or migration corridor as the unit of concern, rather than just one country. In summary, the life sciences and research innovation landscape in the Middle East during this period was vibrant and future-focused. High-impact scientific breakthroughs like Iran's AI-personalized vaccine stood alongside strategic research programs aimed at public health priorities, e.g. Egypt's enormous screening data, Qatar's genomic medicine, Saudi's transplant research and healthy cities analytics. A collaborative ethos was evident. Researchers are partnering with international bodies, as seen with Oman and the UN on NCDs, and sharing knowledge at summits from Doha to Amman. Importantly, many countries are aligning their research agendas with pressing health needs, combating cancers, reducing NCDs, improving maternal, child health, and harnessing digital technology for health solutions. As these research initiatives bear fruit, they promise not only to improve healthcare within the region but also to contribute novel solutions to global medicine, whether it's a new vaccine platform from Iran, a vast dataset on women's health outcomes from Egypt, or a model of digital epidemic surveillance connecting multiple nations. The Middle East's scientific ambition, coupled with its willingness to innovate, signals that the region is steadily transforming from a consumer of medical knowledge to a producer of cutting-edge health research on the world stage. Biotech and pharmaceutical developments are next. The biotech and pharmaceutical sector in the Middle East saw robust activity this week, as countries balanced efforts to achieve self-sufficiency in health supplies with moves to integrate into the global pharma market. A major highlight came from Saudi Arabia, where plans were laid for a new wave of biotech and pharma investments to be unveiled at the end of October. The Saudi Ministry of Health announced that at the Global Health Exhibition 2025 in Riyadh, October 27 to 30, the kingdom would roll out several strategic partnerships in biotechnology, vaccine production, and pharmaceutical manufacturing. Backed by Vision 2030, These initiatives aim to attract foreign investment and accelerate Saudi Arabia's emergence as a regional hub for healthcare innovation. The scale of Saudi ambition is evident. The country's healthcare industry is projected to grow from SAR 199 billion in 2020 to SAR 318 billion by 2030, with the private sector's contribution doubling to SAR 145 billion. To enable this, the ministry is creating a more competitive investment environment, streamlining regulations, and actively supporting innovation across fields including biotech, pharmaceuticals, digital health, and even health tourism. This follows a highly successful exhibition last year that generated over SAR 50 billion in health investment deals. Notable 2024 deals included a SAR 4 billion agreement with pharma giants, NUPCO with Novo Nordisk and Sanofi, to manufacture drugs in Saudi, a SAR 5 billion expansion by a major hospital group, Faki Care, and SAR 4+ billion in acquisitions by Dalla Healthcare. Building on that momentum, the 2025 Expo is expected to yield new agreements in advanced therapeutics, medical technology, artificial intelligence, and digital health solutions, all in line with Saudi's drive for self-reliance and an innovation-led ecosystem. In short, Saudi Arabia is leveraging its market size and capital to become not just a consumer of imported medicines, but a producer and exporter of medical products and technologies. The forthcoming partnerships will likely involve multinational pharma companies setting up local production or R&D centers, as well as support for local biotech startups, thereby transferring know-how and creating jobs. Egypt, with its large population and industrial base, continued to advance its own pharmaceutical development strategy. The Egyptian government's push to transform the country into a regional medicine manufacturing hub, highlighted by the Prime Minister and Health Minister in recent months, remained a key narrative. During the review week, Egypt's presidential 100 million health initiatives made headlines with milestones. As noted earlier, the women's health screening program surpassed 70 million screenings, and the hepatitis C elimination program continues to prevent thousands of liver disease deaths each year. Each of these public health efforts has a pharmaceutical component, e.g. procurement of drugs, development of testing kits, etc., and Egypt has increasingly sought to localize production of these inputs. Earlier in 2025, the Health Ministry convened committees to streamline regulations and incentivize pharma R&D, aiming to boost exports of generics and vaccines. While there was no brand new pharma deal this week, it's notable that the Egyptian PM prioritized health and the Decent Life initiative in his October 2nd remarks, which implicitly supports domestic pharma since these programs rely on affordable medications reaching rural clinics. In fact, Egypt has already had successes, such as producing its own biosimilar insulin and hepatitis C treatments in recent years, reducing costs and expanding access. The Egyptian Drug Authority has also been active, approving new locally made drugs and signing MOUs with countries like Sudan and Iraq to supply medicines, thereby expanding Egypt's pharma export footprint. With the current trajectory, we can expect announcements in the near future of new Egyptian vaccine plants, possibly in partnership with WHO or Chinese firms, or expansion of existing pharma industrial zones, like the GYPTO Pharma City, to meet both domestic needs and export goals. In the Gulf region, investments in biotech and medtech maintained a rapid pace. Abu Dhabi is one example. It has in recent months launched major initiatives like the Abu Dhabi Life Science Hub and the world's first dedicated vaccine holding center. Just prior to our week, during Abu Dhabi Global Health Week in late August, UAE officials outlined bold visions to attract biotech investments and foster an innovation-friendly regulatory environment. That momentum carried into this week, though not tied to a specific dated event. The UAE's long-term commitments were echoed in various forums. Notably, the UAE's emphasis on longevity research and precision medicine. Abu Dhabi has convened global gatherings on these topics and even issued a declaration on longevity and precision medicine, was cited as influencing the region's research agendas broadly. In Lebanon, while not a hub of pharmaceutical manufacturing, a different pharma-related crisis looms: severe medication shortages due to its economic collapse. Though not explicitly in this week's news, it's important to contextualize. Lebanon's import-dependent drug market has been in turmoil since subsidies were lifted in 2021 and the currency plunged. The result has been critical shortages of oncology drugs, insulin, and other life-saving meds, and many pharmacies have empty shelves. This week, health professionals in Lebanon again sounded alarms that the healthcare system is deteriorating to wartime conditions, with the pharmaceutical supply being a major casualty. Absent an emergency plan, Lebanon risks outbreaks of controlled diseases and rising mortality from chronic illnesses simply because medicines aren't available or are too expensive, e.g., only 15% of cancer drug needs were met in late 2025, according to some NGOs. This stands in stark contrast to the investments we see in the Gulf. It's a stark reminder that regional health development is highly uneven. While some countries launch AI vaccines and local biotech plants, others struggle for aspirin and antibiotics. International support, perhaps via initiatives like an Arab Pharma Solidarity Fund or through WHO, may be needed to bridge Lebanon's gap until its economy stabilizes. Summing up the biotech pharma scene, the Middle East is witnessing a two-speed situation. On one track, wealthier, stable countries are plowing resources into building advanced pharma capabilities, localizing manufacturing, fostering innovation, and negotiating as regional blocs to get better deals and set higher standards, like the GCC unified regulatory frameworks. On the other track, countries in crisis are fighting to secure basic drug supplies and maintain immunization coverage. Encouragingly, there are signs of the first group aiding the second, e.g., Gulf donors supplying vaccines and funds to countries like Yemen, Syria, and Sudan, Egypt signing export moves with poorer neighbors, joint OIC procurement of cholera vaccines for member states, etc. This week encapsulated that duality, from the glitzy announcements in Riyadh and Abu Dhabi to the quiet rollout of an aid-funded field hospital pharmacy in Gaza. The region's pharma future will likely depend on increasing collaboration, pooling procurement for economies of scale, technology transfer deals like the Egypt PharmaJet 1, and cross-border regulatory harmonization to speed up access to new therapies. If done right, the Middle East could both empower itself as a producer and ensure even its vulnerable populations benefit from pharmaceutical progress. The trajectory is promising, but success will require maintaining this delicate balance between self-reliance and solidarity. We turn to public health challenges and disease outbreaks. This week underscored a dual reality in the Middle East's public health landscape. Acute crises persist in conflict-affected areas, even as other countries grapple with entrenched endemic challenges. From the humanitarian emergency in Gaza to the chronic cholera in Yemen, the region faces health threats on multiple fronts requiring both immediate response and long-term resilience building. In the Gaza Strip, the humanitarian health crisis remained dire, though a glimmer of hope emerged under a tenuous ceasefire. After more than a year of conflict and blockade, Gaza's health system is on life support. WHO has warned that Gaza's health services are collapsing, and recent data illustrate the devastation. As of mid-2025, an estimated 81% of all structures in Gaza are damaged, including hospitals and clinics. Nasser Medical Complex, Gaza's largest hospital, and several others were severely damaged or put out of service during intense fighting. Basic supplies like trauma kits, oxygen, and antibiotics have been in chronically short supply. However, since a ceasefire took hold on October 10, humanitarian efforts have cautiously expanded. The UN Office for Coordination of Humanitarian Affairs, OCHA, reported on November 2 that 2 field hospitals are being established in Gaza City by international NGOs, International Medical Corps, and the Palestine Red Crescent. These field facilities aim to handle overflow trauma cases and provide surgical capacity, since existing hospitals are overwhelmed. Additionally, 8 health service points, HSPs, small clinics for primary care, have resumed operations across the Strip since the ceasefire. Reconstruction of damaged infrastructure has started in places. Notably, the renovation of Al-Rantisi Hospital in Gaza City is underway, with plans to restore a pediatric ICU there in the coming weeks. Yet challenges abound. The reactivation of the European Gaza Hospital in Khan Yunis has been slow due to access and security issues. Fuel for generators, needed to run ICU equipment and sterilizers, remains critically low. OCHA notes that overuse of generators has created urgent needs for spare parts and maintenance, with some services at risk if fuel isn't supplied. Communicable disease risks are rising too, with dense displacement camps and compromised water systems. Cases of diarrheal disease and skin infections have been climbing. To mitigate hunger and malnutrition, UN and partners have scaled up food distribution. By early November, 1.16 million meals were being delivered daily by over 20 organizations, via community kitchens across Gaza. Still, the situation is precarious. Health officials worry about mental health trauma on a massive scale, especially among children who have endured repeated violence and loss. WHO has evacuated some critical patients out of Gaza. For instance, this week 19 patients with complex injuries, along with 93 family members, were airlifted to Italy for specialized care not available in Gaza. It's a life-saving measure for a fortunate few, but thousands more in Gaza need advanced care that local hospitals can't currently provide. Overall, Gaza's health emergency has evolved into a long-haul struggle, moving from the immediate war casualties phase to one of rebuilding and preventing secondary crises, like outbreaks and malnutrition. The events of this week, field hospitals going up, limited aid trickling in, ceasefire holding, offer a flicker of progress. But without sustained ceasefire and vastly increased aid, Gaza's health outlook remains extremely grave. Turning to Yemen, the world's worst cholera epidemic and a broader humanitarian catastrophe continued with little relief. Yemen has reported the highest cholera burden globally for several years now, and 2025 is no exception. According to WHO EMO data up to December 1, Yemen had recorded 249,900 suspected cholera cases and 861 associated deaths since January. This represents 35% of all cholera cases reported worldwide in 2025, and 18% of cholera deaths, a staggering share for one country. The disease, spread by contaminated water and food, has proliferated in Yemen due to shattered water infrastructure. Many sewage systems and water plants were destroyed in the war, and collapsed public services. During our week, heavy seasonal rains in some parts of Yemen raised fears of new cholera flare-ups, as flooding often spreads the bacteria. The Euromed Human Rights Monitor issued a warning, reported by Ashaq al-Awsat, that between March 2024 and August 2025, Yemen saw around 332,000 suspected cholera cases, indicating the surge has been relentless. Lebanon's public health challenge is a sobering example of how an economic collapse can translate into morbidity and mortality on a large scale. As noted in a prior report, Lebanon's years-long financial crisis has decimated its healthcare sector. This week, the Lebanese Order of Nurses highlighted an alarming trend: hundreds of nurses emigrating or leaving the profession because salaries, paid in collapsed local currency, are insufficient to live on. Hospitals in Beirut and other cities are operating at reduced capacity due to staff shortages and lack of funds to maintain equipment. The Ministry of Public Health warned that vaccination rates for children have dropped as the government can't pay for vaccine procurement like before. They are relying almost entirely on UNICEF, WHO donations now. We're essentially seeing health outcomes slide backwards. Instances of advanced illnesses that used to be managed, like hypertension, diabetes, now going untreated in some Lebanese communities because medications are either unavailable or unaffordable after subsidy cuts. There have even been outbreaks reminiscent of poorer countries. Last year, Lebanon had a cholera outbreak, its first in decades, that affected over 600 people and caused a handful of deaths, likely due to poor water in refugee camps and deprived areas. In 2025, scattered cholera cases continued, showing that without consistent utilities and healthcare, diseases find a way back. This week, some glimmer: the World Bank's funded project to support primary healthcare in Lebanon disbursed another tranche, allowing a network of 200 primary care clinics to continue offering subsidized care through 2026. Yet the head of one major hospital bluntly said that Lebanon's healthcare is now on par with war zones, despite no active conflict, a result of economic implosion. Amid these crises, there were also proactive efforts to address public health threats. Jordan, relatively stable, took a novel approach to drug addiction recovery by integrating fitness and wellness into rehab programs, as we saw in August with the Amman Rehab Center gym opening. That program continued this week with reports of positive patient engagement in exercise classes as part of therapy, a small beacon of innovation in mental health and preventive care. In Sudan, outside our core region but impacting it, a cholera outbreak in 2024 had killed over 2,400 people across 17 states. Aid agencies in early October 2025 were scrambling to prevent spread into refugee camps in Chad and Egypt, which would compound regional public health burdens. And globally, October 8 was World Sight Day, which Middle East countries used as a platform to promote eye health, Qatar's campaign described in Wellness section. These show that even as acute crises grab headlines, public health authorities are still trying to push forward on preventive measures and awareness for the long term. Overall, this week's public health developments paint a dual picture: acute crises in some parts of the region and persistent endemic challenges in others. Conflict zones like Gaza, Syria, and Yemen suffer a convergence of trauma injuries, infectious outbreaks, and systemic collapse that demands urgent humanitarian intervention. Middle-income countries like Lebanon and Iran show how economic and political breakdowns can yield health catastrophes reminiscent of wartime. At the same time, Gulf states and others are grappling with slower-burning epidemics of NCDs and lifestyle diseases, requiring sustained education and policy shifts, taxes on soda, better urban planning, etc. The common thread is that health gains can be fragile, decades of progress can be undone rapidly by war or economic shock. It reinforces calls by health experts for greater international support and regional solidarity. Indeed, the region's health leaders increasingly recognize that collective action is needed, whether it's negotiating ceasefires to protect hospitals, pooling resources for vaccination drives, as the OIC is doing for polio and cholera, or sharing expertise to prop up failing systems, as Saudi is doing via telehealth with Syria. Without such measures, the Middle East risks a widening gap in health outcomes, where some countries surge ahead with world-class care while others struggle with 19th-century plagues. The events of this week underscore that health security is inseparable from peace and economic security. Protecting and rebuilding healthcare in the region's vulnerable spots is not just a moral imperative but in every nation's interest, because diseases and instability do not respect borders. Each emergency is a test of the region's resolve to act together, and each success, however small, like a field clinic opened or a cholera shipment delivered, is a step toward a healthier, more stable Middle East. Digital health innovation, always key to discuss. Digital health innovation is transforming the Middle East's healthcare landscape, and this week provided vivid examples of how technology and healthcare are converging, from national-level data integration projects to cutting-edge hospital systems and cross-border telehealth links. A headline digital health development came from Abu Dhabi. The Emirates' leading healthcare conglomerate, M42, announced a partnership with Oracle Health to create unified, longitudinal electronic health records, EHRs, accessible across the UAE. This initiative, unveiled on November 3, is particularly groundbreaking because it will integrate data from the Emirati Genome Program directly into patients' EHRs. In practical terms, that means a patient's genomic information, such as gene variants affecting drug metabolism or disease risk, will be available to clinicians at the point of care. Oracle Health systems will enable pharmacogenomic recommendations in real time during clinical encounters, so that doctors can tailor prescriptions to a patient's genetic makeup. For instance, if a patient has a genetic variant that makes them metabolize a certain medication poorly, or at risk of side effects, the EHR could flag that and suggest an alternative drug or dosage. Seema Verma, a top Oracle executive, and former head of Medicaid in the US, noted that delivering such insights at bedside will help provide more personalized care and prescribe medications that are tailored to a patient's genetic makeup, ultimately increasing treatment efficacy and reducing waste from ineffective prescriptions. M42's group CEO, Dimitris Mulavasilis, stated this program will empower both clinicians and patients with actionable data, shifting healthcare towards prevention and personalization. He described a future where providers deliver proactive care, shaping a healthier future for communities across the UAE. This move builds on Abu Dhabi's broader digital health strategy, which includes its Malafi platform, the Emirates Health Information Exchange linking public and private providers, and initiatives in AI-assisted diagnostics. By layering genomics into the picture, Abu Dhabi is leapfrogging into what many call Health 4.0 or precision health era, ahead of many Western systems that are still siloed. Challenges ahead will include training doctors to interpret and use genomic data, ensuring robust privacy and cybersecurity for this sensitive information, and maintaining interoperability so that records from M42 Oracle's system connect with Dubai's Nabid or the Mo systems. But the direction is set. The UAE envisions a future where AI and big data guide every patient encounter. On the telehealth and connectivity front, the fruits of earlier agreements were evident. Saudi Arabia's much-publicized digital health link with Syria, stemming from a September mal, saw its first concrete outcomes, as reported by Saudi press agency. The connection between Syria's Ministry of Health and Saudi's Sayha Virtual Hospital has already addressed 2 complex medical cases remotely. In one case, a 35-year-old Syrian patient with a severe heart attack was virtually reviewed by a Saudi cardiologist who guided local Syrian doctors on advanced interventions, saving the patient's life. In another, a pediatric neurology case was co-managed with input from Riyadh specialists. These success stories, highlighted on Al Arabiya's interview with Minister Al-Jalajel, underscore that the new link is just the beginning, hinting at more tele-ICU and teleconsultation support being extended to Syria's fragile health system. It also speaks to the power of digital health as diplomacy. Saudi Arabia can project soft power and goodwill by healing beyond its borders, all enabled by technology. Domestically, Saudi Arabia's Sayha Virtual Hospital network continues to expand its repertoire. It now covers over 35 subspecialties and connects 152 hospitals within Saudi, providing services like stroke telethrombolysis, time-critical clot-busting treatment guided remotely, and teleradiology reads overnight. The ministry announced that thanks to AI triage and teleconsults, waiting times for certain specialties in remote areas have halved. During our week, Saudi officials also met to discuss integrating telehealth into medical education so new doctors are trained in virtual bedside manner. Dubai's achievement with Faqih University Hospital attaining HIMSS Stage 7, mentioned earlier in Wellness and Digital Intros, deserves a closer look in the digital health context. HIMSS EMRUM Stage 7 means the hospital is essentially paperless and uses electronic systems throughout all clinical workflows. This is a big deal in a region where many hospitals, even new ones, often still have hybrid paper-electronic processes. Faqih Hospital has demonstrated advanced analytics like predictive models to identify patients at risk of deterioration and closed-loop medication administration, where the EHR and pharmacy systems manage med orders, and nurses use barcodes to verify patients and meds, nearly eliminating med errors. The hospital's CEO Dr. Mohamed Abdelghani said, "Achieving HIMSS Stage 7 is a testament to integrating advanced digital solutions into every level of patient care, implementing innovation, we are humanizing it." That quote captures a key point: technology for technology's sake isn't the goal, it's about using tech to enhance safety, quality, and patient experience. For Dubai, this accolade fits into its Smart Dubai 2025 strategy, which includes a goal for 100% of applicable public services to be smart. In healthcare, the DHA and the private sector are clearly aligning with that. Other UAE hospitals are not far behind. Several in Abu Dhabi and Dubai claim to be at EMRUM Stage 6 and aiming for 7 soon. Regionally, Qatar's Hamad Medical Corporation achieved Stage 6 for a few hospitals earlier, and Saudi Arabia has many hospitals at Stage 6 in its digital transformation journey under the Watani EHR project. But Faqih is the first in the entire GCC to hit Stage 7, outside of a couple of Aramco clinics that might have done it earlier for smaller settings. This sets a benchmark and will likely spur healthy competition. Indeed, some news reports say a couple of large UAE government hospitals are fast-tracking new EHR upgrades to try for Stage 7 in 2026. Why does this matter? Because a higher degree of digitization strongly correlates with lower medical errors, better care coordination, and ability to do population health, since you have the data to mine. It also made Faqih a lifeline during COVID-19. They could shift to telemedicine almost overnight and use their data to manage ICU resources effectively. We can anticipate that the next frontier for these digital hospitals is to get JCI Digital Hospital Certification or similar, which goes beyond EHR and looks at broader smart tech usage, IoT, robotics, etc. Another digital health highlight, M42, Abu Dhabi's health tech arm, and Oracle's partnership isn't just about genomics. It's also about building the UAE's National Health Information Exchange. In the press, they talk about unified longitudinal records accessible across the UAE, which suggests they aim to connect Abu Dhabi's Malafi, Dubai's Nabid, and other emirates into one system. This is hugely ambitious from an IT standpoint. But if achieved, it means any ER or clinic in the UAE could pull up a patient's entire medical history, with patient consent, regardless of where they were seen. That's a holy grail of healthcare that even many developed countries haven't attained fully. It can eliminate redundant tests, prevent drug interactions, and make referrals seamless. Given that Oracle Health, formerly Cerner, already powers Malafi and parts of Dubai's system, it's plausible. The sticking point might be governance, e.g., who owns or manages the national exchange, but the UAE's structure of a federal MOH plus strong local health authorities can handle a collaborative model. The timing aligns with the UAE's broader digital government drive and its preparation to host COP28 later this month, where they'll want to showcase innovations including in health. On the AI in healthcare front, beyond the Iran conference noted earlier, there are multiple small developments. For instance, in Israel, part of the broader Middle East though not the main focus of our report due to political context, researchers announced an AI algorithm that can predict which COVID patients will need dialysis, reflecting the region's strength in health tech startups. In Turkey, a tech company unveiled an AI radiology tool for earthquake-related injuries, likely spurred by the recent quake response. These indicate that AI solutions are sprouting across the region's health sectors. The challenge will be scaling them and integrating them into clinical practice, which requires regulatory frameworks. The UAE and Saudi are ahead here, both have drafted or released guidelines for AI in healthcare, e.g., the UAE's coming guidelines mentioned in the biotech section. Those frameworks cover how to validate AI tools, ensure patient data privacy, and clarify liability if an AI recommendation goes wrong. Another area of digital innovation is mobile health, mHealth, apps and wearables. In our week, the Saudi MOH promoted its revamped Sehati app, which now integrates with Apple HealthKit and Google Fit to allow users to share their wearable data, steps, heart rate, directly with healthcare providers. The idea is to encourage patients to meet physical activity targets and allow doctors to monitor lifestyle metrics between visits. The app also launched a mental health self-assessment and a chatbot that answers basic medical questions. Saudi Arabia claims over 24 million eHealth app users across all its apps, a sign that the population is quite engaged digitally. Meanwhile, telemedicine not just for humans but also for veterinary and agricultural health popped up in Qatar, perhaps offbeat, but Qatar's Ministry of Public Health partnered with the Ministry of Municipality to develop an e-platform for reporting zoonotic diseases and coordinating vet responses. Egypt continues to digitalize its health services at a rapid clip too. On November 4, WHO Egypt announced a new training initiative for patient empowerment using digital tools. And Egypt's health ministry, through its healthcare authority, is rolling out the Universal Health Insurance System, UHIS, which heavily relies on digital patient records and e-claims. As part of UHIS, an app, Shifa, is being introduced for Egyptians to book appointments and access their health data. In fact, Egypt reported that they remotely approved 2,045 treatment cases by video conference in a couple of months, showcasing telemedicine used for administrative efficiency, medical board approvals. In the Levant, Syria, in government-held areas, has surprisingly made some digital strides given the circumstances. The Ministry of Health there, with support from WHO and other UN agencies, has set up an electronic disease early warning system, EDUS, that aggregates illness data from sentinel clinics via mobile reporting to detect outbreaks quicker. This week, whose acting representative Christina Bethke mentioned that despite Syria's transitional funding gap, there's progress in health information systems that needs continued support. An interesting philanthropic angle on digital health, Case Relief, Saudi's relief agency, donated an additional $4.5 million to WHO in Syria to support, among other things, digital health solutions for frontline clinics. It specified that part of it will fund solar-powered tablets and internet for remote clinics to use whose e-learning and telemedicine platforms, ensuring even war-torn regions can consult specialists. This is digital innovation in its humanitarian avatar. On security and ethics, as digital health grows, conversations about data security are intensifying. This week a GCC task force on cybersecurity met, virtually, and one topic on the agenda was protecting health sector data, acknowledging that hospitals and health databases have been targets of cyber attacks globally. The GCC is contemplating region-wide standards for health data encryption and breach response. The UAE also issued updated telehealth regulations on November 1, requiring that only licensed local providers can give teleconsultations to patients in the UAE, to maintain quality control, and that such teleconsultations must happen over approved secure platforms. Finally, innovation ecosystems to support digital health startups are flourishing. On November 5 to 6, Bahrain held the Global Health Tech Forum as part of its Startup Bahrain Week, attracting regional entrepreneurs who pitched solutions like AI mental health chatbots and blockchain-based medical supply chains. Investment interest is rising. Saudi's NEOM just announced a $100 million fund earmarked for health and biotech startups in its futuristic city project. Bringing it all together, digital health innovation in the Middle East is not a side experiment, it's becoming a core component of healthcare strategy. Countries are at different stages, the Gulf states surging ahead with integrated e-records, AI, and smart hospitals, others like Egypt and Jordan focusing on telehealth and digitizing basic services, and conflict-affected states leveraging what tech they can for resilience. This week's developments, from unified genome-empowered records in Abu Dhabi to a HIMSS Stage 7 hospital in Dubai, from telecardiology saving a life in Syria to drones being tested for medicine delivery in Oman, a pilot that took place on November 3 in Muscat Seed District, collectively indicate a region embracing the digital revolution in health. The promise is improved access, telehealth bridging rural gaps, higher quality, decision support reducing errors, and more personalized care, genomic and wearable data guiding choices. The challenge will be to ensure these innovations are inclusive, serving all populations, not widening disparities, and secure, protecting patient rights and data. Judging by the momentum of this week, the Middle East is eager to meet those challenges head-on and stake a claim as a global leader in digital health transformation. Finally, we have population health management. Population health management, the organized effort to monitor and improve health outcomes across entire communities, gained traction in the Middle East this week through large-scale surveys, expanded screening programs, and cross-border collaborations. Countries are increasingly investing in data-driven initiatives to understand their population's health needs and target interventions, marking a significant shift towards proactive health governance. A prime example is Kuwait's launch of a National Population Health Survey, KNPHS, which was actively promoted and rolled out in recent weeks. Kuwait's Ministry of Health has embarked on this comprehensive survey to gather detailed data on the health status, lifestyle risk factors, and healthcare utilization of a representative sample of Kuwait's residents. The survey aims to reach 12,000 individuals from 8,000 households across all 6 governorates, making it one of the most ambitious health data collection efforts in Kuwait's history. Participants will undergo home visits by certified health teams, a doctor, nurse, and field researcher, who conduct health assessments including measurements of height, weight, blood pressure, lung function, dental checks, and vision tests. Lab samples are taken for cholesterol and blood sugar, with results shared securely via the Kuwait, Shlanik, or Sahel health apps to the participants. The goal is multifaceted, to establish baseline indicators for chronic diseases, like obesity, diabetes, hypertension, and risk behaviors, diet, physical activity, smoking prevalence, and to evaluate the quality and accessibility of health services. Kuwait's MOH explicitly states this will guide future health planning and policy. For instance, if the survey finds a high rate of undiagnosed diabetes in certain areas, resources can be allocated for clinics or health campaigns there. Or if obesity rates in youth are alarmingly high, it could prompt stronger school nutrition policies. Importantly, Kuwait is doing this in collaboration with WHO, using the standardized STEPS survey methodology to allow international benchmarking. The ministry ran awareness events in popular venues, like the Avenues Mall, to encourage public participation and transparency about the process. As Dr. Abdullah Al-Saned, the MOH spokesperson, put it, Kuwait has undergone major demographic and lifestyle changes in the past 30 years, and understanding their health impact is voluntary but crucial for improving healthcare planning and disease monitoring. Preliminary participation has been good. By end of October, dozens of households had completed the survey, albeit a far cry from the target, so the MOH extended the data collection through early 2026. Kuwait's initiative reflects a broader regional trend, using population surveys and health registries to move toward evidence-based policymaking. Similarly, Qatar, which ran a national stepwise survey back in 2012 and 2021, has been building on its data. Qatar's public health strategy includes establishing a national health registry observatory that compiles data from various sources, surveys, electronic records, etc., for a holistic view. On October 23, whose regional office noted a collaboration with Qatar to set up a national health observatory as a platform for integrated health data. This week, Qatari officials followed up by discussing how outputs from their recent World Cup 2022 health impact studies and ongoing Qatar Biobank findings will feed into population health insights, for example, learning about cardiovascular risk factor trends in the young working population. Egypt, with its massive population of over 100 million, has been notable for large population health initiatives. One flagship is the 100 Million Healthy Lives campaign, which over the past 5 years has screened tens of millions of Egyptians for hepatitis C, hypertension, diabetes, and obesity. The campaign's results are indeed being utilized for population health management. As reported this week, the data from the Women's Health Initiative, 70 million screenings done, is being analyzed to adapt treatment guidelines and resource allocation for women's health services. Additionally, Egypt announced the issuance of 902,000 state-funded treatment approvals in just 2.5 months, August 1 to October 20, under their financial protection programs. This was presented not just as service statistics but as an indicator of population needs, showing the burden of conditions requiring expensive interventions and where the government is focusing subsidies. The approvals covered a broad range of specialties from cardiac surgeries to oncology to renal dialysis. Notably, the ministry highlighted that 2,045 cases were assessed remotely via telemedicine for these approvals, which is population health management in action, ensuring equitable access by leveraging tech. Another Egyptian milestone, as of October 2025, the new universal health insurance system had been rolled out to 6 governorates, Port Said, Luxor, Ismailia, South Sinai, Suez, and Aswan. Phase 1 cost EGP 51 billion upgrading infrastructure, and Phase 2 is expected to cover 5 more regions. The UHIS aims at universal coverage by 2027, earlier than the original 2032 target, which is fundamentally a population health endeavor, pooling funds and expanding access to improve overall health outcomes. This week, UHI's leadership emphasized integration of home healthcare, with 2,000 home visits done in pilot governorates, as part of a continuum of care. Serving patients at home not only improves individual care but also alleviates hospital loads, showing a systems approach to population needs, especially for the elderly and chronic patients. A significant regional population health effort is the fight against polio and other vaccine-preventable diseases, coordinated through entities like the Organization of Islamic Cooperation, OIC. As noted in earlier sections, OIC health ministers, including those from Pakistan and Afghanistan where polio remains endemic, have been working on joint vaccination drives. This week in Kuwait, on the sidelines of the GCC meeting, there were discussions about the OIC's polio eradication initiative. The GCC pledged support to help Pakistan in its upcoming immunization campaigns, recognizing that polio anywhere is a risk everywhere. In fact, environmental surveillance in several Middle East countries, like sewage testing in Egypt, Iran, and Israel, occasionally detects polio virus traces, likely from travelers or neighboring countries, so regional vigilance is crucial. Cross-border population health management was a theme, e.g., Jordan and Syria started talks to synchronize immunization days for refugees and border communities, to ensure no one falls through the gaps. Also, the WHO EMRO simulation on cross-border disease surveillance, mentioned earlier, recommended establishing a Middle East regional infectious disease surveillance digital platform, which effectively means managing the population health of a mobile population that moves between countries. Egypt drafting an agreement with Sudan for mutual recognition of vaccination records is exactly that kind of population health cooperation. Refugee and migrant health is another key aspect of population health management in the Middle East. Countries like Jordan, Lebanon, and Turkey host millions of refugees, whose health needs must be integrated into national plans to avoid public health issues. Jordan has been exemplary. It provides vaccinations and primary care to Syrian refugees nearly on par with its citizens, and in return has gotten global support. This week, Jordan received a batch of tuberculosis medications from a WHO USAID program to cover not just Jordanians but also refugees in its territory. Meanwhile, in Lebanon, despite turmoil, the health ministry with UNICEF vaccinated over 300,000 children, Lebanese and Syrian, against polio in a fall campaign, a critical step because population immunity must be maintained. The Middle East also saw a focus on non-communicable disease, NCD, management at the population level. For instance, Saudi Arabia's recognition of healthy cities, 16 of them, indicates a population health approach where cities are graded on a basket of community health indicators. Achieving WHO healthy city status means those cities met criteria like greater than 80% immunization, safe water access, local health promotion programs, etc. For Jeddah and Medina to get that, first big cities in region to do so, was touted as a success in population health management, aligning urban planning with health. Oman continued its strong tradition in population health. It has long-standing programs like the National Diabetes Registry and the NISWA Healthy Lifestyle Project, which WHO often cites as best practice. Oman's session on a national NCD policy, October 1st, means it will set population targets, like reducing smoking by X%, cutting salt intake by Y%, and mobilize various ministries to achieve them. It also recently completed, late 2024, a stepwise NCD survey with support from WHO, providing updated prevalence rates for NCD risk factors, data that will feed into the new policy. Bahrain is leaning into population health management via digital means. It's working on a National Health Information Exchange, NATIJ, and a population screening program called Checkup that invites all adults over 40 for comprehensive health checks every 2 years, for diabetes, cholesterol, cancers, etc. In our week, Bahrain's health ministry reported high uptake in its free breast cancer screenings, tying into Pink October, and is planning to integrate those into a single patient profile that tracks individuals' preventive care uptake, essentially managing a roster of who's due for what screening. Kuwait's population health management got a boost not just from the survey but also from a new Kuwait Health Observatory, launched with WHO, a portal for health indicators and trends that policymakers and researchers can access. They also revived an intersectoral committee on the social determinants of health, reflecting an understanding that factors like housing, education, and environment must be part of managing population health. Another element is health insurance and financing as a tool for population health. Let's summarize this week's review. In the first week of November 2025, the Middle East's healthcare narrative has been one of momentum and resilience, a region in motion towards a healthier future even as it contends with formidable obstacles. This week's developments showcased a Middle East that is investing, innovating, and collaborating like never before. Governments are enacting bold policies to expand care and contain costs, researchers and companies are breaking new ground in biotech and digital health, and communities are embracing wellness and preventive care. At the same time, ongoing conflicts and humanitarian crises kept the spotlight on the region's vulnerabilities, reminding us that progress in one area can be fragile if instability persists in another. A key theme is reform meeting reality. We saw high-level visions, from Saudi's health transformation under Vision 2030 to Oman's national NCD policy, being translated into concrete action, hospitals built, laws passed, and partnerships forged. Countries are learning to balance immediate needs with long-term strategies. For instance, Egypt simultaneously provided over 800,000 citizens with free treatments in a matter of weeks and pushed forward systemic reforms like universal insurance and data-driven planning. The message is that commitment to healthcare is now a political and social priority across much of the Middle East. Leaders increasingly recognize that healthy populations are the foundation of economic development and social stability. This week's news, whether a minister championing a fitness initiative or a prime minister reaffirming health spending, reflects a level of political will that bodes well for sustaining health sector improvements. Another striking theme is innovation and self-reliance. The Middle East is no longer content to import solutions, it is developing its own. We heard about Iranian scientists designing an AI-driven cancer vaccine that could put the region on the map of medical breakthroughs. We saw Gulf countries like the UAE and Saudi Arabia moving to produce medicines, vaccines, and even medical devices, like Egypt's needle-free injectors, locally, reducing dependency and building export capacity. Digital health is enabling smaller countries to punch above their weight, Bahrain and Kuwait using data smartly to manage population health, and Qatar leveraging its tech infrastructure to implement genomic and precision medicine programs. This drive for innovation is partly pragmatic, e.g., vaccine equity issues during COVID taught a lesson, and partly aspirational, many Middle Eastern nations aim to be regional if not global centers of excellence in health. Over time, these investments in knowledge and manufacturing will likely pay dividends in the form of better health security and diversified economies. The burgeoning health economy is poised to be a growth sector in the Gulf. Crucially, regional cooperation and solidarity emerged as both necessary and possible. Health, often a neutral ground, became a conduit for dialogue and aid in a fragmented political landscape. Saudi Arabia and Syria bridging diplomatic divides via a telehealth partnership, Gulf states jointly planning disease control strategies, Egypt coordinating vaccination records with Sudan, and the collective response to cholera and polio, all these indicate a recognition that health challenges transcend borders. The week's events underscored that whether it's stopping an outbreak, responding to disasters, or sharing research, countries achieve more when they work together. This growing regionalism in health is a hopeful sign. It could pave the way for broader collaboration in other spheres, leveraging health as a bridge for peace and trust. And in practical terms, regional approaches make sense. Pathogens don't need passports, and health innovations can spread faster through shared networks. The human stories behind the headlines also shine through and give context to the progress. A Jordanian patient in addiction recovery finding new purpose on a treadmill, a Gazan mother seeing her child receive an IV drip at a field hospital that wasn't there a week ago, Saudi nurses proudly adopting an AI tool that helps them catch errors, an Emirati woman getting her first mammogram for free at a mall, an Iraqi family in Baghdad hearing that a big new hospital is planned in their city. These individual experiences, multiplied thousands of times, the real measure of change. For many people in the Middle East, health reforms and initiatives are not abstract, they are felt in daily life, sometimes in life-saving ways. There is still a long road ahead to ensure every person in the region can access quality healthcare without hardship. But the week's developments provide evidence of progress. More people are being screened, treated, educated, and empowered to care for their health. Looking ahead, the region faces some critical tests and opportunities. Humanitarian crises, notably in Gaza, Yemen, and Syria, remain urgent and will require sustained international support and local leadership to prevent further tragedy. The coming months will show whether ceasefires or peace deals can hold, which would allow health systems in those areas to start rebuilding, a precondition for any lasting improvement. Economically, as some Middle Eastern countries tighten belts due to global conditions, protecting health budgets will be key. This week fortunately saw, if anything, increases in health spending in places like Saudi and Egypt, but vigilance is needed to keep healthcare funded during fiscal pressures. On the upside, several major health milestones are on the horizon. The Middle East's first gene therapies coming to market, likely in the UAE or Saudi by next year, possibly the region's elimination of certain diseases. Polio is hanging by a thread, one good push could see it gone from Asia, Middle East. Onchocerciasis in Yemen and Sudan could be eliminated with new WHO bio efforts, and big events like COP28 in Dubai, where climate health will be a focus. We already saw mention of extreme heat initiatives, and this could drive funding to climate-resilient health projects. The region is also preparing for Hajj 2026 in Saudi Arabia, which always tests public health readiness. Lessons from COVID have led to improved disease surveillance for mass gatherings that we might see deployed. In conclusion, the week of October 31 to November 6, 2025, showed a Middle East health sector that is dynamic and determined. Tremendous opportunities for advancement exist, from leveraging youthful populations and new technologies to expanding successful pilot programs region-wide. At the same time, vulnerabilities remain: conflict, economic volatility, and disparities that could widen if not addressed. The trajectory glimpsed this week, one of energetic reforms, innovation, and regional cooperation, offers hope that the region can navigate its challenges and continue improving health and wellness for its people. As always, sustaining momentum will require political will, adequate funding, and peace. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.